Mr. Chairman, thank you so much for having this hearing. I really appreciate it. Senator Tester, thank you for your courtesy in allowing me to go forward. I heard Senator Tester's opening remarks. I couldn't concur more. Mr. Chairman, I didn't hear yours, but I'm sure you said all the right things too, so thank you. All right. Secretary Wilkie, undoubtedly community mental health providers, social services, many others have really a key role to play in establishing a comprehensive system of support for veterans to reduce the number of suicides. A 2014 RAND report found only 13% of community providers met readiness criteria to deliver mental health care to veterans, and last year RAND found just over 2% of community providers in New York meet all 7 criteria for readiness to be able to treat veterans. It seems like we have a long ways to go in creating a highly effective network in our communities to address this crisis. So I wanted to ask you, how will you oversee the quality of mental health care and services from our community providers and make sure care for veterans in need is seamlessly coordinated?
That is the key. And I think the goal, well, I know the goal of our task force is to make sure that we not only have the best standards when it comes to mental health care, but that we guarantee that those community providers meet those standards. Part of the task force is to create a national research roadmap, and I think will augment the standards that VA already has. I see the grants, the research grants, the community grants that will come out of this, and Senator Bozeman has introduced legislation today that will get us farther down that road as being the key to making information more readily available to our community providers and make their care more robust. And Dr. Franklin can give you more figures.
No, I definitely also appreciate the question as a clinician myself, the importance of training providers on evidence-based practices and cultural competency or cultural humility, if you will, for military sector and veteran is critically important. And we do have a partnership with an organization called Psych Armor that's also taken it on as their mission to train mental health providers across the nation, not only mental health providers, but employers and a host of others on how to interact with veterans and what are the evidence-based protocols and things like that. And I think there's going to have to continue to be a push towards this, not only from our partners, but also from trade organizations like the National Association of Social Workers, APA, the Psychological Association, the Psychiatry, and getting the standards into their credentialing and protocols, and then continuing to hit it hard over time will be part of the way forward.
Okay, thank you. A critical issue covered in the department's national strategy for preventing veteran suicide, but that was not touched on in your written testimony, is the issue of restricting access to lethal means. Even a few seconds that disrupts an individual's intent can end up saving their life. This is incredibly important, especially given the high proportion of veteran suicide by firearm. VA, I know, has taken some steps to restrict access to lethal means, like distributing gun locks, but to build on that work, how will your strategy expand these efforts to restrict access to lethal means?
Well, you are correct, and it is key. 70% of veterans who take their lives do so with firearms.
Correct.
Now, we are dealing with a culture that has special familiarity with firearms. It's been part of their ethos. The goal here, and we've worked with the American Foundation for Suicide Prevention and groups like the American Shooting Sports Foundation, is to build into a veteran's life time and space between the impulsive thought and the final act. That comes with greater awareness in terms of us reaching out to veterans and educating them. We have a comprehensive education program that we are now providing on gun safety. As you mentioned, we give gun locks out. Lethal means safety is something that we take very seriously. And it is that psychological condition that we have to build in that I think we are starting to do to increase the likelihood that the impulse will not increase the last act. But to go further, The budget that I presented to this committee has $9.5 billion for mental health services. I think the House will actually up that number when it finishes its work. Part of that will be dedicated to outreach and education when it comes to the conditions that lead to a death by firearms.
I'm out of time, and Mr. Chairman, I really appreciate it. I just want to make sure I'm going to submit some questions for the record. One is about our other than honorable discharge folks and how we can make sure they get better than access, and also women veterans. I was alarmed that your testimony said the suicide rate among women veterans is nearly twice that of their civilian counterparts. I often hear from women that they don't get the care they need because they feel harassed or assume that when they're there, they're waiting for their husbands. We need to do a better job there, so I will be submitting questions and would like response on those as well.